Sally Pacholok has co-written a book with her physician husband on the dangers of vitamin B12 deficiency called Could It Be B12, an Epidemic of Misdiagnosis? She joins me on the phone to talk more about this. And Sally, thank you so much for taking time to speak with us.
Well, thank you for having me.
So before we get into the book itself, let's talk about vitamin B12. What is it and why is it so important?
A vitamin B12 is a vitamin that you need for health and for life. And it's a very difficult, of all the vitamins, very difficult to absorb. And it commonly causes mental problems and neurological problems, which could be numbness and tingling, paresthesias of your arms and legs, weakness, dizziness, balance problems, falling in the elderly, confusion, disorientation, depression, dementia. Anything neuropsychiatric, any of those signs and symptoms, a person always should have the doctor should always rule out B12 deficiency.
And it's funny, Sally, because when you talk about all the symptoms, you talk about the dizziness, and I'm thinking this mimics a whole bunch of other things.
Yes, it does. So a lot of people who are diagnosed, say, with dementia or Alzheimer's or Parkinson's or chronic fatigue syndrome, they can easily slap a label or say depression, any kind of psychiatric disorders. If you already have a diagnosis, sometimes the physician fails to look further to see if B12 deficiency could be a problem. And because B12 deficiency is a very difficult vitamin to absorb, it takes several steps in the gastrointestinal tract to absorb it. It is a common vitamin that people can become deficient for a variety of reasons.
And so when you say that, are you talking about a vitamin that we actually take orally in our mouths?
Well, no. Vitamin B12 is in food. It's in meats, dairy. It's not in any vegetables. So people get enough of it in. Okay. Now, vegans and vegetarians and people on macrobiotic diets, they tend to have a lower B12 because they're not taking the food in. But the number one problem, either being a vegan or eating like regular meat diet, is a malabsorption problem. So when people have a malabsorption problem, the amount of food, amount of vitamin like in meats and products that you get B12 in is not enough to correct a deficiency. And it's a very slow, insidious process that over time you may not notice symptoms like from one day or from 1 month to the next. And that's why it can easily, you compensate, and then over a period of time you become deficient. So it's not to put vegans against meat diet people, but anybody can have a B12 deficiency. When people take certain drugs, proton pump inhibitors, that decreases the amount of acid the stomach produces, and that's one of the steps that you need a lot of acid to absorb B12. So vegans and vegetarians are higher at risk because they're not getting it in their diet, but people who eat a variety of foods and meats and eggs and cheese, they also have to be careful because they could have a malabsorption problem or not enough stomach acid. And people over the age of 55, they have known that 30% have a process where they have low stomach acid and they have a chronic atrophic gastritis starting. And that could be one of the many reasons why you cannot absorb B12 as you used to when you were younger.
So Sally, let's go over again the signs that you could have a B12 deficiency.
The signs and symptoms of
The signs
B12?
and symptoms again.
The signs and symptoms are anything neurological, which could be with the brain and nervous system, numbness and tingling, confusion, disorientation. People think they blame people getting older and start getting a little dementia and confused. That could be a B12 deficiency. A tremor. Anything psychiatric, irritability, psychosis. A real thing for women, anybody with postpartum depression absolutely always should have B12 deficiency checked out. Pregnant mothers, they have high risk for having a B12 deficiency. There's not enough B12 in prenatal vitamins, and there's a different risk factors. Some women have celiac disease, which can cause a B12 deficiency that they don't know. Some women have Crohn's disease. Some women have a gastric bypass, like for weight loss. Some women are macrobiotic vegans and vegetarians, so they have lower B12. If they breastfeed, their babies are not getting enough B12.
And so as you just talked about the signs and symptoms, so that's really what happens when you have a B12 deficiency.
Well, what it does, B12, you need it for the brain and the spinal cord. What it does is it attacks the myelin. They also classify B12 deficiency as a demyelinating disease. And what that means, the myelin that surrounds your nerves, it becomes destroyed. It's attacked. And so you don't get the nerve impulses. So that's why you get the paresthesias or the tremor. It attacks that myelin. It's similar to multiple sclerosis is a demyelinating disease. So if you look at all the signs and symptoms of multiple sclerosis, anybody with MS, that's where they have to decide. Always rule out B12 deficiency. Why? B12 you can correct. There's a treatment for it versus multiple sclerosis there isn't. Another people that are at risk is anybody with an autoimmune disease. There's one form of B12 deficiency called autoimmune pernicious anemia. That's where the body attacks the stomach cells called the parietal cells, and you have an autoimmune phenomenon that you do not absorb enough acid. So that's another reason younger people can have a B12 deficiency.
And you mentioned younger people because B12 deficiency can affect all ages, right?
All ages, from infants to geriatrics.
And so are there tests out there that can be done? You mentioned doctors testing people for this. What kind of a test is there?
There's two good tests. The serum B12 is a good test, and then there's another test called a urinary methylmalonic acid. The B12 is a good test, but the problem with the B12 is that our range, our current range for what's considered normal is much too vast. For instance, the hospital I work at, the range is 211 to 911. That's a huge range. So when people come back, say 300, and they have signs and symptoms of B12 deficiency, the doctor said, oh, your B12 is fine. They really have a problem. So there's a more sensitive test called a methylmalonic acid. And what that is it's a normal product that we have in our system, and when you do not have enough B12, there's a pathway that when there's not enough B12, this methylmalonic acid rises and rises and rises. So when that methylmalonic acid, or we call it MMA, is elevated, that means that you have a B12 deficiency. Now, they can do it in the serum, in the blood, or they can do it in the urine. The reason why we advocate the urine is because a lot of elderly people need to be tested, and they're higher at risk for B12 deficiency of the entire population. And this urinary methylmalonic acid test, what it does is they normalize it to the urine creatinine to correct for urine dilution. What that means is when elderly people have renal insufficiency or renal failure, that test can correct it, and that way you get a true value. In the serum, they can't do that, and then sometimes they think, well, maybe it's elevated because of their renal function, and then they discount it, etc. So it's another sensitive way to look for B12 deficiency. Now, another way that if we would change the parameters of what a normal serum B12 is, you probably wouldn't have to do the urinary methylmalonic acid. But in some people who have liver diseases and different areas, the urinary methylmalonic acid is a good test. But you need, and they found in the literature that people who had a serum B12 of 400 and lower, if they're symptomatic, they always say do the methylmalonic acid. There's another test too called homocysteine, but it's elevated when you have a B12 deficiency, but it's also elevated if you have a folic acid deficiency, a vitamin B6 deficiency, and if you're hypothyroid, and if you have renal problems. So it's another test, but it's important because what people really don't know, they think, oh, just, B12 is not important. Not only is attacking your nervous system where someone could actually become paralyzed from this and lose the ability to walk from a B12 deficiency, and this has been recorded in malpractice cases of younger people where they failed to identify a patient. But